Today we have such an amazing presenter, and I'm so excited for this. We have Julissa, who is a psychologist with a master's in family therapy. She is a diabetes educator and has an educational program in Spanish, and that has given her the expertise in video blogging, community building, and mental health. Julissa lives with type 1 diabetes, and her relationship with it has been a curious one from the start. Most of her diabetes education has come from social media, but she noticed a trend that there was no information in Spanish. She went on and created her own blog titled as Diabetes Tipo Who to provide peer support and educational network for all families living with diabetes. So with that, I'm going to hand it over to you, Julissa.
Thank you. Well, hi, everyone. I'm really excited to be here. I think that the subject that we have to talk about today is a really interesting one for us living with type 1 diabetes. I'm trying to see, we have mostly women. Of course, men are also totally welcome, and we know that we all have to deal with these subjects. And
Just a second.
Yeah, I'm sorry. I have a lot of experience in the clinical field with people with or without diabetes, but like Gamble said, the blog that I have has allowed me to read a lot of experiences that people share with me on a daily basis. And I have been really fortunate to be able to get to know and experience myself this really complicated relationship with everything. So on the next slide. Yeah, well, that just again we have the learning discussions and objectives for this session. It is to discuss what are some of the implications living with type 1 diabetes regarding body image and food, and this encompassing in mental health, and what can we do to make this relationship less complicated. Like we're stating that I know this is really subjective. I know that many of us, I think it's mostly adults living with type 1 diabetes. So some of you may be saying, no, I haven't had any issues, but some of us really feel that and live with that perspective. So I think even if you feel like you really have a good relationship with this and that you don't have any sort of issues, you can still benefit from knowing some of the data that we're going to be presenting today. So the next slide. Yeah, so whenever I talk about a subject regarding mental health or body image or anything that we always seem to know, because media always seems to be talking about it. No, we can go to a magazine stand and see all the front pages like body image and how can you relate better to it and how you can be more acquainted with your body. So I want you just to touch base on what do we understand as body image. And it is how you see yourself when you look in the mirror or how you picture yourself in your mind. All of this encompasses what you believe about your own appearance, including your memories, your assumptions, and generalizations about you, how you feel about your body, including your height, shape, and weight, and how you sense and control your body as you move, how you physically experience or feel in your body. Many of us internalize messages starting at a young age that can lead to either positive or negative body image. Having a healthy body image, it's an important part of mental well-being and eating disorders prevention. So in this matter, the thing that can lead to having a good body image or a good relationship to it, it can be so subjective. It can be like something that we didn't even realize that was there. We could have received these messages when we were really little. Like, for example, just when we admire a pop star, for example, and they have some sort of image, a body image, the way they relate to it, or it can be something as direct as having a parent, a teacher, schoolmates bullying us, teasing us for, I don't know, a body part, the way that we look, the way that we dressed ourselves, the way that we have. We all know that these beauty standards that exist out there, they're not really reachable, and they're not even real in most cases. We know that all of the photos are being photoshopped right now, so we know that we're not even dealing that those women or men that we so admire don't even have that face and don't even have that body, even if they've been through surgeries or stuff like that. So it's really important that we can always have this in mind, that the way that this appreciation that we have of our body image not necessarily came from something that we did. It could have been formed when we were really little, when we did not have the maturity or the defenses to deal with those sort of comments that some people may think that they are trying to help you, like, oh, you should put on more makeup, or you should do your hair differently. But those types of commentaries can really hurt us if we're not ready to receive them, or if we don't know really where are they coming from. So I think we have the first poll next. Yeah. Do you consider your relationship with your body image to be a difficult one or a healthy one, just based on what we have previously mentioned?
Okay, the poll is going to end in 5 seconds. All right.
Okay, so 90% of people who are participating said that I also voted, and I also said that I have a difficult relationship with my body image. So thank you for participating, and a healthy one, 10%. That it's great. And the second question is, if you said difficult, do you think diabetes affects your body image? The answer is yes or no.
And we're ending the poll in 5 seconds again. Excellent.
Okay, so 93% said that they think diabetes affects their body image, and 7% said no. Well, thank you. I really thought that we were going to have like a superior percentage of being a difficult and diabetes affecting it. I didn't believe that it was going to be the most people voting that way. But we have to keep in mind that what we're dealing with and the type of condition that we live with, this abstract right here that I'm going to tell you right now, it's extracted from a really interesting study. I cited it on the bottom part. You can read it, or maybe I can pass around the link so that you can read it more at attention. But given the detailed meal planning, precision in food portions, and constant monitoring of food intake, carbohydrates in particular, we know that very well, related to insulin doses recommended for diabetes management, people with diabetes may be inherently more prone to issues revolving around food. This is just like a fact. We may be more prone. That does not mean that we are condemned that there's nothing we can do about it, but it is a factor, and it is something that we have to keep in mind. The way that we can do something different is by first being familiar with the type of things we are presenting and the type of things we are dealing, and this condition that we live with, how it can makes us relate to food, how it can makes us relate to everything else. So the persistent focus on food that it's intrinsic to diabetes management also lends itself to greater difficulty of detection of eating disorders and disorder eating in the susceptible population, us being the population, right? So if we want to have like a really good diabetes management, we have to have a great deal of time, a great deal of the day, a focus on food. And that I'm going to say the word normal, but I don't mean it like we're abnormal and all of the other people are normal. When I say normal, I'm just referring to the fact that most of the population that don't live with this condition don't have to relate to food in that way. That does not mean that the way they relate to it, it's healthy. It just means that we have to be really, really on top of it. So the next point that I'm going to try to make, and that I think it's one of the most important for us living with type 1 diabetes and being adults, I think that some of these subjects are only discussed when people are teenagers. And yeah, that it's the main focus, it's maybe in that population, because it's when they're most at risk. People in the teenage years, they only want to belong to something, they want to be normal, they want to whatever, so that makes them more susceptible. But that does not mean by anything that we as adults are not also living with it. So I'm going to talk to you a little bit about the eating disorders that we know, that we're really familiar with them, starting from anorexia. I had a note right here. This information came from the National Eating Disorders Association. Anorexia is when people generally restrict the number of calories and the type of the food they eat. Some people combine this with exercise compulsively, and also purge via vomiting and or binge eating. So the main thing that we're going to have in anorexia, it's the restricting of food. And it can also present itself with extremely weight loss, or you can notice maybe in the person that lives with anorexia, in the body weight that they have. It's really perceptive. I think in the eating disorders, this one is the most dramatic one in regards of a visual aspect, because we're basically seeing the person with a really low weight when it gets out of hand and when it goes all the way. With bulimia, it's life-threatening eating disorders. I think it's really important, and maybe we are all familiar with this. Any eating disorder, it's life-threatening. It's really, really difficult because it messes with everything, with every aspect of our lives. The nutrition that we're getting, the way we're relating to ourselves, the way we are living, it messes with everything. It also messes with the way we relate to our family. People mostly don't know how to deal with a person living with an eating disorder. So yeah, and in bulimia, there's a cycle of binging and compensatory behaviors, such as self-induced vomiting, or designed to undo or compensate the effects of binge eating. I think it's also important to notice that with bulimia, it can be presented with binge eating, but it can also not be with binge eating. So maybe people just have a small portion of food and they are still inclined to compensate that with vomiting. So the next one, and I find this really interesting, the binge eating disorder, it's the most common eating disorder in America. So a binge eating disorder, it's when there are episodes of eating large quantities of food, and then again trying to use compensatory measures to vomit or to use laxatives to get rid of everything that we eat in a really compulsive way. And also this is like we were restricting ourselves really bad, and we were trying to be that way, and then we ended up binging. And then there's a lot of emotions and feelings that go into this, and then we feel shame, we feel guilt, and we have to do something to get rid of that. So we vomit or lax ourselves or whatever. And bulimia, the one that it's most interesting for our community, and I have a little bit of an issue with this, because not necessarily, bulimia can be bulimia, diabulimia, it's exclusive to people who are on an insulin regimen. And what it is, it's when a person purposefully restricts insulin in order to lose weight. So we don't apply the insulin that we need, or that we know that we need to process the carbohydrates that we're eating, so that we maintain ourselves in high blood sugar numbers, so that we produce some sort of diabetic ketoacidosis. And when we are in diabetic ketoacidosis, we start to lose weight because we have ketones in our body, but that is a really unhealthy way to lose the weight. But it's a pathway that only us people living with type 1 diabetes have. So if managing a hormone like insulin, it's so hard. And when we give this to somebody who not necessarily has the maturity, who not necessarily has a good body image, a good relationship to it, it's really difficult for them to be managing this in a healthy way. So diabulimia, it's something that happens when we restrict our insulin intake. We maintain ourselves in high blood glucose numbers so that we lose weight in that incredible unhealthy way. But those are the main and the most investigated eating disorders. But right now we have something that is disorder eating. Some people started to in the clinical field to know that wait a minute, I don't think the relationship that this person has with food, it's a completely healthy one, but they don't meet the whole criteria to put them in a eating disorder. So this is what gets us to the disorder eating. What could be disorder eating? Well, maybe when people eat when they're bored, or when they're anxious, where they have the same thing for lunch every day, or they when cut out a main food group. And this subject can gets us here talking about it like 10 hours. So because I know that many of us in the community are inclined to have a keto diet, but not necessarily that will be the best option for everyone. I'm not trying to, I think the main thing to keep in mind when we are talking about what sort of food regimen we want to have living with type 1 diabetes, it has been clearly proven that not just one diet it's best for everyone. So we need to keep that in mind, because I know we are really inclined to say, oh no, if you reduce your carbohydrate intake, your blood glucose numbers are going to be so great, and then you are going to be able to have like a more normal life. But that's not the case for everyone. And we also know that that is not an ideal case for people who are still on development years, such as teenagers, for example. They need to have a food intake determined by a healthcare professional. So leaving all that discussion aside, we know that this is some sort of disorder eating when a person is just trying to avoid one consequence and they are willing to let out something that their body needs. So societal standards and pressures, as well as preoccupations in weight loss and exercise, may lead individuals to alter and manipulate their food intake. For many people, this works. And we have to be really mindful of this, that for some people, this disorder eating, it's going to be sustainable. And some of the key points that we can keep in mind to see if we are on that path or on the other path who's not so healthy, it's when it does not interfere with our lives and people are able to find food they're comfortable with in any restaurant and there is no desire to change. So there may be a part when the one eating conduct, it's disorder eating, but it can work. But that is not something that we have to determine ourselves. That is something that we can and we should consult with our healthcare professionals team to see and to evaluate. In the next slide.
Sorry, guys, we're experiencing a little bit of technical difficulties here. Oh, if you can unmute yourself again, Julissa, that'd be great.
Yeah.
Thank you.
I'll continue talking about the disorder eating. But, well, we saw that we have some people with disorder eating that this may work, but there are some other people that this way of eating can be a precursor to a full-fledged eating disorder. And in many cases, it is really hard to distinguish when an individual is struggling with a disorder eating versus an eating disorder is at play. But from a clinical perspective, all who have a non-normalized, and we previously mentioned what it's normal or not normal, a relationship with food, have an opportunity for introspection, reflection around their patterns and behaviors in relationship to food and exercise. So I think this is where it starts to get really tricky for us living with type 1 diabetes, because to keep a well managed diabetes, to be in healthy numbers, to have a good A1C, we may have to go into some disorder eating. We have to be really mindful, maybe weighing some macronutrients, maybe just staying with some sort of food. But in the next slide, I'm not able to see completely the chat group, but some messages appear, and some of you have shared with the group, and I'm really thankful for that. And that shows that the power of community, right? When you feel in a safe space to be sharing something really personal and something really difficult, as it is living with an eating disorder or disorder eating. So thank you for that. But some of other people that are not really familiar or that have not been treated for some sort of eating disorder may be thinking or asking themselves, how do I know if I should be worried? What if this gets worse? Like, I know I'm not having the healthiest relationship with food, but how do I know if I need to get help in this matter? Right? So these are not only questions and concerns for loved ones, but also for individuals who are unsure what type of help do they need. And something to be really mindful of, and 3 key points that are going to help us to really know if what sort of help we should be asking. It's being really mindful of behaviors, obsession, and functionality. I myself, I had a period in my life where I was living with type 1 diabetes and I was not eating meat. I went vegetarian, and in the moment it made sense. There were a lot of situations where I wanted to just try that food intake or that diet. And at the beginning, I felt really good. It was really sustainable for me. I had some different job when I started that diet, but at the end, it started to mess with my life, right? So I think it's really, I found it really curious when the authors in the clinical trial said that one of the key points to see if we are relating to it in a good way or healthy way or not is if you can find something to eat in many restaurants or not. And that was really curious for me, because when I was in this sort of regimen, it was completely out of the range for my social life, my social group, my family, but I always managed to find something to eat in every restaurant I went out, even if I ended up eating just the sides, right? Like a mashed potato or a salad, or in the worst case scenario, I could always find some sort of French fries, right? So but when it started to not be really functional, and that is one of the 3 key points, it's when my job will not allow me to cook for myself. So I was always eating on the street. Not that eating on the street, it has to be like junk food, but it's starting to get really expensive, and I was not getting the nutrition that I needed. So my body started to pay the price. And in that moment, it's when I had to question myself, like, am I going to stay with this regimen that right now it's not being really functional for me, that I'm seeing in my lab tests that my body's not really agreeing with it. So, and in that case, it's when I decided to make a switch. So this is a part when I want to remind all of you that it's not one size fits all. Just like we know that with diabetes management and treatment and technology, we don't have that just one way of being and one way of treatment and just one insulin works for everyone. It's the same with food. The thing is that we need to be able to question it, and to question it to ourselves first, so that then we can go to some professional to see if what we came up it's good or healthy enough for us. Thank you. It can be just to keep in mind when you're questioning yourself, of course it can be normal to think about food when you're hungry or what you might have for the next meal. But for those struggling with an eating disorder, the thoughts are generally all-consuming. The individual thinks about calories, taste, food avoidance, or where to buy food the whole day. This they may be keeping logs. They may be weighing their food. They may be doing, I don't know, something else that it's not really healthy. The next slide, please. And that level of obsession can impair focus and the ability to stay present and to sleep, and among other things. We know that as women, when we really have an issue with eating, the first thing that pays the price, it's our period and all of our hormonal health. We lose that. We need fat. We need food to keep that process going. And living with type 1 diabetes, we know that when we have an issue with that, we have an issue with the way we process insulin, and our whole diabetes management, it's going to be altered. And it's difficult to judge how much time and energy another person is spending thinking about food or using behaviors, the individual may offer this information, or it may be evident that they spend more time at the grocery stores, or perhaps they're isolate more, or they go into the more frequently, or their general behavior and patterns change. So I think this is a really, really tricky point, us being adults, because it's not the same at all to have a teenager that's being looked at by their parents in our household. But when we are adults, it's so easy to have an eating disorder, or to have disorder eating, and to be completely not noticed. Because we work, even if you live with a partner, you can tell them, oh yeah, I already had breakfast, I already eat. No, I'm not really hungry. When after work, we went to eat some pizza or whatever. And now not one person is going to be able to say, no, you're not eating, or no, whatever. But this can happen not just with a completely diagnosed eating disorder, but with disorder eating. So in the next slide. Thank you. And I think this is one of the most, if you're going to take away something from this, I want it to be this. It's like a continuum. And we live in with a condition that requires us to always be mindful of food, to have a difficult relationship, and to judge food, because I'm sure that everybody can relate to the feeling of that food, it's really bad food. But because one day we ate it, and our blood sugar levels skyrocketed, and it almost generates like a visceral reaction to it. Like, I don't want to eat that. I had that happen to me with oatmeal. I had that happen to me with rice. So I know for a fact that this is not a healthy and not an easy relationship to carry on. And we see that in one extreme, we have the eating disorders that we already talked about, like anorexia, bulimia, binge eating disorder, in our case, bulimia. And in the middle, we have disorder eating, that I believe, and maybe it's a really bold statement for me to make, but I believe that most of us living with type 1 diabetes, the least that we have is disorder eating, because the way we relate to food, it carries a physical impact that we can observe right in our faces, and it also has like emotional impact of the food makes us feel like we are good or bad diabetics, that we have good or bad management. And that almost is not the norm for all the other people, right? I don't know, sometimes when I read online that what is the first thing you would do if you get cured by type 1 diabetes? And most people say, like, I would go and eat like a really huge cheesecake and not think about it, and have a giant Coke and have all the French fries. And so if that is one of the main desires of people, that means that they always feel in an emotional feeling of restricting, of I cannot do what I want, I cannot do what I desire in the moment. I have to be mindful. And that it's true. And we cannot judge it because we live with it. We have to find a way to, and the way in the other extreme, it's body acceptance, healthy eating habits, healthy weight for our age, height, and body type. And this is really important because for us girls or women, we have a huge load of social pressure that even if our body type, it's not compatible with weight, we want it because that's the beauty standard that is what it's being presented to us. That is what we should be able to get to. And that it's really hard, because it's not only that we have type 1 diabetes, it's not only that we have a complicated relationship with food, but also that we are women in a society where whatever you live with, you have to also be beautiful, skinny, or with more hips, or with whatever. I'm seeing some questions. Let me see. What are some things you personally do to keep your body? Okay, at the end of the presentation, we're going to get at it. What about those of us who obsess most about but have given up no time to alcohol? Okay, thank you for your questions. In the next slides, we talk about what we can do. Okay, so we're going to get to the second poll. So how our body reacts to insulin is unique. And I think that is also really, really important to keep in mind, because yeah, there are these papers, there are these investigations, but we know that in practice and in the real life, sometimes it does not translate like that, right? So for some people, it may cause you to gain weight. For some other people, it may be hard to put on weight. You may also get bruises or marks left by injections or wear an insulin pump. You can that can also lead to having a negative impact on your body image, because those are physical reminders of type 1 diabetes. So for the poll, do you use diabetes technology? I'm referring to CGM, pump, even if those two are not connected.
Great, Tyler. End the poll in 5 seconds. And just a reminder, please keep putting in questions in the chat, and we'll collect them. And then at the end of the presentation, we'll ask. Loving all the conversation that's happening so far. So thank you, everyone. Okay.
Okay, 90% of us use diabetes technology and just 2% no. Okay, thank you so much. And the next question. If you suggest that you use diabetes technology, do you wear it out and proud, or do you prefer it not being seen?
Five seconds. Great.
Thank you. Okay, so yeah, 63% of people wear it out and proud, and 37% prefer not being seen. Thank you so much. So this leads us to another part of the diabetes world that only we have to deal with it. And there's a lot of debate and peer pressure from social media to be really open and proud about wearing medical devices. And it appears to be the new normal right now, that we're being bombarded with new normal. But there's not just one correct way to relate to it. Whatever feels right for you, as long as it does not interfere with your life in other aspects. It could be the same 3 points that we saw with the eating thing, with the food thing. If it does not interfere with ourselves, and I think it's really important, because I know in the US, the narrative of wearing medical devices is a little different, but here in Mexico, it's like, if you use medical devices, you have to be so proud, because it's such a privilege. And it's also a burden of like, if you're lucky enough to wear it, because yeah, those in Mexico who use diabetes technology are really lucky. There's a burden that comes with it, like you cannot be ashamed, you cannot be tired of people asking you, what is that in your arms, what is that, blah, blah, blah. But we also know that there are a lot of people who choose to not use diabetes technology and have a great management of their blood sugar and of their diabetes, and have perfect A1C. I myself had the best A1Cs with no hypoglycemia in MDI. And I did not have a CGM, and it completely depends on what we're dealing with. And I think it's really important to also keep in mind that it completely depends on the stage of life we are living. It can be like completely not ideal for me to use diabetes technology right now, but maybe in 2 years it could be the best option. Oh, I'm sorry. So we are getting to the what can we do to make this better? Sorry, okay. My main advice is to be softer with you. I cannot stress this enough. I think that the whole human race can be really more softer with us. What do I mean by this? Be softer with you and in a really loving way, understanding that dealing with type 1 diabetes, it's not easy. And even if we have all the tools, all the technology, everything that there is for the world offered to us in a silver platter, it's still not easy. And there, of course, there's going to be days when they're great and we have great numbers and we're really going to be really mindful of what we're eating and everything's going to be birds and sunshine and rainbows. But there are some other days when it's not going to be like that. And those are the days that we really need to be soft with us, to not judge ourselves, to be loving with ourselves, to not compare ourselves to other people, to other managements, to other bodies, because we don't know what each one of us it's dealing with. So the other thing we need to do to make this better is talk about it, to know that you are not alone, and that living with type 1 diabetes, it's not easy. I know there are not a lot of healthcare professionals who are really able to keep a conversation of this level of understanding. There are a lot of mental health aspects that interfere and intertwine with diabetes management. There's really not so much people with that, but when we talk about it, we make it more visible. We're being loud. I see some of the comments that you're putting there, and I just know that just by sharing that experience that you have yourself, some other people that maybe are not ready to be outspoken about the struggle that they're living with, they're reading your comment and they're saying, oh my God, I have the same. I don't feel so alone right now. I'm not that crazy. Whatever, right? So if you feel like people near you don't understand, there are great online resources. And well, like this one, for example, we know that Beyond Type 1 has great online resources. We know that Connected in Motion and those camps are, oh my God, so great, because you can be there and see the people. I myself was diagnosed as an adult with type 1 diabetes, so of course I did not have the experience of being a kid and going to camp and whatever, and I had the opportunity to attend to a camp. It was mostly for teenagers, young adults, but I was a facilitator in the psychology area, and I was like a little kid all over again, like, oh my God, I can drop dead right here. And everybody would know how to treat a hypo. And that is something that I have never experienced. And it's really great. I don't know if you have seen the movie, I forgot the name, The Parent Trap, where, you know, the girls change and they meet in camp and they're twins and whatever. When I saw those experiences of camp, I was like, no, camp can't be that good, but it is. And it's not because you're outdoors that of course it helps, but it's because you are with people that you know on firsthand. They understand you and you understand them, and it's so great to have that sense of community. It's I don't know, I think we all should be able to experience that. And if we cannot experience, and right now, of course, no one of us can experience it in person, we can experience it online. And just be really mindful that the people you are following or the people you are talking to, or in the community, share the same values that you do, because some people do not share that, and some people are just completely inclined to say, no, diabetes is great and it's the greatest thing that ever happened to me, and I have never had a day where I hated it in my life. And when we are struggling and we hear that sort of narrative, it's not going to help us. It's just going to make us feel worse. So be really mindful of the people that you intend to follow, and that they are soft with themselves, and that they allow themselves to be human, and to have good experiences and bad experiences, and all of them. And in a more clinical perspective, in the next slide, well, consultation and referral to mental health services is an appropriate first step for screening and treatment. So like we were saying, you may be, after seeing this or after reading something, you may be asking yourself, well, I don't know, I have always done this way. I have lived with type 1 diabetes for 30 years, for 40 years, and I have always done it this way. How can I know if this is healthy or not? Or and the most precious thing about it is that you are not alone in this. You don't have to have the answers. That is why we are here to help you. We are here to help you. We are the healthcare professionals that really specialize in this field, are really, really glad to assist you in this. You don't have to be the expert. You don't have to resolve everything by yourself. So various treatments exist for eating disorders or disorder eating, including, oh, I'm so sorry. I lost you for a second. I'm so sorry. There's a lot of various treatments for eating disorders: family therapy, cognitive behavioral therapy, interpersonal psychotherapy. I myself, I'm a psychotherapist, and I have accompanied people with disorder eating and type 1 diabetes. And of course, it's not easy, but there's always a way to makes us feel better, to keep inclining ourselves in this continuum that we saw, that eating disorder eating, and healthy body image and everything. There are always little approaches and little steps we can take to get to the other side. And also, nutritional counseling is recommended as a component of successful therapy. Eating disorder treatment, it's a complex and lengthy one, and sometimes a lifelong process. In the next slide. Yeah, so when I say about the lifelong process, some of us can be really, we're getting there. Thank you. About the lifelong process, I know that some of us can read that and say, oh my God, that is so discouraging. What do you mean about lifelong process? I don't want that. I want a easy, healthy, fast way to deal with it. But I want to use type 1 diabetes as an analogy about this lifelong process in getting our body image, our mental health, our self-esteem better. We don't, for example, if I say tomorrow will be Monday, and I want to forget about type 1 diabetes this week, so I want to apply all the insulin tomorrow for the rest of the week so that I won't have to deal with this. And we all know what would happen if we do that. We cannot, no matter how great our management was yesterday, we have to do a lot of steps today to keep that up or to make it better. We have to keep going, and we have to work in it every day. But that is not like a life sentence. It's just that we have to do it. It's the way you eat every day, you brush your teeth every day, you sleep every day. We work most days, so it's the same with our mental health, the same with practices or self-esteem. And I think the beauty in this is that when we do this work constantly, well, I don't know, some of you, if you practice yoga, maybe you can understand this, that when you have a regular practice of some discipline, some sport, there will get to a day when maybe it was not your best day, or you couldn't train the same amount of time or whatever. But this is those difficult days, those difficult moments in life are going to be sustained by your daily practice. And just to keep in mind that everything counts, everything. Just as we do on type 1 diabetes. If we usually eat healthy, if we usually do what we have to do, we can have one day when we have cake and soda and ice cream. I don't know, just to mess up our hair a little bit. And it can be really good, and it's healthy for our minds. So yeah, it's a lifelong process. But that is not a bad news. That it's something that tells us that it's going to be a continuous process of working on it, and it's going to be really worth it at the end. It's going to be sustained by our effort in every day. So just to tell you where you can find a little bit more of this. I'm on every platform as Diabetes Lipo Ju. Yeah, my content is mostly in Spanish, but you know that in Instagram it can really easily translate. So, and of course, I will be so glad if you write to me with anything. I'm always on there. I'm always on the DMs and the inbox and everything. And I really love to hear about you and share experiences. And I really believe that in type 1 community, we need to be more spoken, open about all these mental health issues and body image issues. And just to remind yourself that you are not alone. You don't have to deal with this alone. If you don't feel like you have a safe space around you with your family or friends, there are always safe spaces on communities. I've seen some people have share links. I see some people have share resources. So just keep that in mind. This does not have to be a lone path for you to go through. We are all in this together. We understand how difficult it is. We understand that also there are days when it's great, but just be softer with you, be softer with yourself. And Tara, I don't know if we have questions.
Hi, that was such an incredible presentation, Julissa. That I think this is one of the most engaging workshops we've had so far. So thank you everyone who's been so vulnerable and talking about their stories and their struggles throughout the chat. And I think this is like absolutely a topic that we don't address, but yet it's something that is so common between everyone who has diabetes, and it's not just gendered oriented. So thank you so much. So we do have quite a few questions that have gathered throughout. So the first one is, what are some things you personally do to keep your body image and food relationship positive?
Well, I think that right now in this day and age, the main thing to do is what kind of media we consume. If we're always feeding ourselves with, and not to be like not feminist, but anybody can do anything with their body. But if we're always seeing like the Kardashians and people who are altering their body image and that are putting up impossible beauty standards, that is not going to be healthy, because our mind will reluctantly compare ourselves with them, and that ends up with us feeling bad about it, even if that is not something that we want, just because it's something that it's been like pushed down our throats, that you have to get to this weight and this butt size and this lip size, and it's not real. So first and most easy step is to be mindful of the media and of the images we are consuming. And when we stop and analyze that, the second step we can take is to, because our internal dialogue, it's so composed by what we have been hearing all of our lives. And that is not necessarily something that we want. So when we stop and we are starting to judge somebody that, oh my God, how can she put on that shirt? She looks so good. And it's like, oh, wait, it's her body, her choice, and it's okay. And when we start to do that for other people, we can start to do that for ourselves. Like, yeah, I'm gonna wear this, but it's not in season, but it's not for your body type, but it's not for your color of your skin, that does not suit you. It's whatever. If I feel good in it, I'm able to wear it. So we start to change the way we relate to ourselves by, when we start to not judge other people, we can start not judging ourselves, and we can be more tolerant with diversity. And the most important and the most beautiful thing we have in life is diversity. And I think right now we are seeing all the issues that we are facing socially, when we do not respect that diversity, when we believe that something is better than other thing. And we're not going to get political, but that is what happens when we do not respect that every life matters, and that every person is beautiful, and that every size and every age group, it's beautiful. Because that is also another thing, right? That, oh no, I'm getting older, so I cannot do this and this and that. That it's not true. That it's just societal standards that are so outdated, and we do not have to abide by them.
Awesome. I have goosebumps right now. That was so inspirational. So thank you. We're going to continue the conversation, but we're going to end the Facebook live stream right now, so then we can have a really engaging conversation. So with that, thank you so much today for such an empowering presentation on body image. It was so valuable, and thank you so much.
Thank you guys for being here.
Okay, awesome. Okay, so now we're done live streaming. So we do have a lot more questions for you, and we can see everyone's face. The next question we have is, who should we talk to about food disorders topics? Like, should we approach your endocrinologist, a CDE, a psychologist? And if so, do you have any reviewed professionals that you trust that could help with diabetes and eating disorders?
Okay, yeah, well, a safe way, this depends a lot of the type of healthcare professional teams that are around you. But if you feel like in your healthcare professional team, you have people who are really mindful and really pay attention to the mind health part of everything, mental health part, then yeah, that will be the first step, because those are the people who know your treatment, who know you, who have your data, and that could be good. But if you don't feel like, and I know a lot of people do not feel that with their endos or with their nurses, you can go to our CDE, because most likely they should have some sort of training on the psychological aspects. And if all else fails, yeah, you can go directly to the psychologist. Of course, the most ideal scenario would be to find a psychologist or psychotherapist that knows about diabetes, or that specializes in eating disorders, at least, because it is a little bit different, the language that we speak, the things we have to deal, we need them to be familiar with diabetes burnout, diabetes distress, these some sort of things. I don't know, Tara, if you know the name of there was a psychotherapist in the Canadian Slipstream, Michelle, I believe. I
Michelle
don't remember.
Sorensen.
Yeah, she was great. You should all go to see her Facebook. I believe it's still in Facebook, in Connected in Motion. Her session was amazing because she was talking of the implications in mental health of using diabetes technology. So she has a clinic, I believe, and she can do online sessions. So that will be a great a resource. I know that there was another therapist in this, I believe it was yesterday, in the US Connected in Motion, a Slipstream. But yeah, of course, that will be the ideal, to find a psychotherapist that knows about diabetes, but we know that that may not be possible for all of us. So at least someone that it's really mindful of what you are telling them. Just make sure that you don't feel judged and that you feel in a safe space, even if they are not the most experts on diabetes. That is the main focus with healthcare professional.
Nice. Thank you. Yeah, it's such a struggle. There really isn't that many resources out there, and especially I imagine in different languages, as it's predominantly in English. So it's a really big struggle. And like I announced before, it's something that all of us kind of have an ordeal with eating. It's such a complicated relationship. So the next question is, how do you deal when you overload eating of carbs and you can't resist eating anything, something else with heavy carbs, or even if it's just guessing insulin doses? So overall, is avoidance in or diabetes a disordered eating ordeal?
Kind of, yeah. Yeah, that, I don't know. We have to analyze a little bit more aspects, but that just by itself sounds like it could fit on the disorder eating. We have to analyze a lot of factors, like how often is this happening? How often are we seeing all of this? And how is it disturbing you in all of the other aspects in your life? But here is, for example, I believe if you are just seen with those sort of behaviors, like a CDE could be a really good first person to assist to, and maybe a nutritional nutritional accessory, so that you can have maybe some other strategies when you're dealing with this. Like, okay, so you have a lot of anxiety for eating. Maybe when starting in a regimen, you can eat this sort of food instead of this one, and it will be like less of a damage in blood glucose management.
Yeah. The next one we have is, I think as anyone, we kind of obsess of trying to lose weight, and there's lots of reasons why, to look better, to have better diabetes management, but it's very hard and it's very tiring. And some people might go to alternative measures like alcohol. The yo-yo dieting is hard, and they're wondering if you have any tips to help change this behavior.
Yeah. I think that when we talk about eating disorders, and that is something that I'm not really comfortable with, if you have been familiar with some clinics that treat eating disorders, it's almost like people are drug addicts, right? Like that's like the same kind of management or approach that they have. And I just believe that when we start to see all of the areas of ourselves, when we start to broaden our vision, to know that it's, what is the main thing that it's trying to keep you, that it's making you trying to lose weight, at what cost? Why are you willing to go against yourself to deal with this, what is going on. It's always an emotional underlying issue. It's never just a food issue. It's never just that. So this is where psychotherapy comes really handy, to start asking the right questions. Not just stay on the food level or the dieting level, because the root or that issue usually stems from the not self-worth, low self-esteem. I don't think I'm good enough just with this. So we have to work a lot of self-love, compassion, acceptance, and this is when it can get really really hippie, really spiritual, really quick, but it's a way for something. Practicing yoga, practicing meditation, practicing mindfulness. It's really, really important that we can start to incorporate these subjects into our whole diabetes management, because it's the only thing that on the long run, it's going to help us manage all the aspects on all the other areas that we have to do this. So just to sum it up, be mindful of your mind and of your emotions, not just the food. Yeah, the food, it's just like the front, but it's not the main issue.
Yeah. Really great response. So the next one, we're going to talk a ton of two things. So lipo hypertrophy, so that's essentially kind of like the bulging, like a lump under the skin from the accumulation of fat. And that could be due to multiple injections that we always occur. So do you have any tips of either helping with that or even having that, acceptance of it? We had quite a few questions, especially with, lower belly fat, of trying to have insulin management and working out and trying to flatten their abs, but they just can't find anything that can help break down that lipo hypertrophy. Do you have any tips?
Well, the main tip that we have to be really mindful is rotating sides, because when we really, really rotate sides, it's the best way to avoid that. When we didn't took the measures, or some bodies just respond differently and are more prone to present this, you have to go to a dermatologist to get it checked. I know some people use some sort of ointments and but sometimes it can get real bad to the point that it has to be surgically removed. So that is not something that we want to deal or diagnose ourselves in our house. We have to go to a professional to tell us what is better for it. But just if you already have that tissue affected, do not apply more insulin on it. And I know, of course, we developed this sort of preferred zones, right? And mostly it can be stem from one day I applied a infusion set on this side, and it hurt really bad, so I'm never going that way, and I'm always keeping it in that side of the body, and that is what keeps that. And again, here we can put the mindful aspect. When we are just doing our diabetes care in an automatic way, just oh yeah, I have to go through it, maybe we are worsening that and we are not being aware of it. So when I always try to make it like a little ritual, I get myself in, I take a shower, I go out and I apply some sort of ointment or whatever to help the skin restore itself, because yes, it is damaging and it is not cool and it is not pretty, and of course it affects with our mind because our body image is affected and we can see it. So if you pay more attention to what you are doing, you can lessen that. And of course, please go to a dermatologist so that they can evaluate what sort of measures we can take.
Awesome. Yeah, it's such a struggle. I know I struggle with that quite a bit. So a next kind of like short question. Do you have any experience working with anyone who has PCOS, so Polycystic Ovarian Syndrome? And if that like affects the mood, if any little tiny tips you have?
Yeah, well, PCOS, it's really, it can be really common with women living with type 1 diabetes. And it's a real struggle because, yeah, it's a whole hormonal thing, and it causes insulin resistance. It causes some other processes to be altered. So the first I think that the main character in this has to be an endo, in a really good endo, because we have to be like in close management and observation of our insulin levels. And I know that being active physically really helps. Of course, it's not an easy thing to treat, because this is when living with an autoimmune disease, we know that it can spark some others. I know that a lot of people live with type 1 diabetes and Hashimoto's disease. So PCOS is another one like that. It's really common. So in that case, just be really mindful of your food, to keep to whole foods, not really ultra processed foods are not a good friend for living with this. But yeah, it can alter the mood. But since this is really about the endocrine system, the first person we have to go, it's with an endo. And when we are sure that we have that taken care of, then we can also complement that attention with a psychologist or therapist, of course.
Yeah, great. Thank you very much. So we are running out of time, and I'm probably going to leave with this last question. Please, everyone, feel free to continue the chat afterwards. I would probably suggest taking, one of the cafes, like the Best Bean or the Call-Ups Cup. Maybe you guys can chat about that as we had throughout the chat. So thank you. So this question, do you have any, cognitive behavior therapy resource that you recommend, or any books, any podcasts, or anything that really helps you out?
Yeah, well, I just read a book that it's really a good book. It's from Tara Brach. She's like a Buddhist psychologist, and it's called Radical Self-Compassion. CBT has some workbooks. You can find that in Amazon. And those that are workbooks, I find them more useful than just like the whole theory, because in the workbook you start to work on the issue in itself, and you can find CBT for almost all the things that you want. It can be like an anxiety, that it's also a thing that I know a lot of us deal with, and hypoanxiety, hyperanxiety, and it can help with that. There's also a great book that it's called The Body Keeps the Score. For the author, it's Bessel van der Kolk. It's a really famous book, but it's really good. It talks about a lot of, he's a psychiatrist, and he was one of the first people to treat with PTSD, and everything that they found out, how the relationship with the body and the mind and all the things that appear there. And it's really interesting because I think whenever someone says like, what are the best things about living with type 1 diabetes, and I don't find a lot of like, oh, it's the best thing that ever happened to me. But one of the benefits that we have is that we have to be really mindful of our body, or we should, if we want to keep a good glucose, and eating and sleeping, and we know all of the things that affect. And this book talks about a lot how is all of this related, and how our brain works with it, and how if we have some sort of, especially with food also, it can be a traumatic relationship with food. This explains a lot of how we can approach that. And it's always it's with a holistic approach, like body, mind, food, exercise, meditation, sleeping, everything.
Awesome. Thank you so much. Last reminder, if you could possibly just fill out this survey and give feedback for today's session. I know I found it so valuable, and just kind of really connecting that, that food image and, tying in with diabetes distress of, fear of hypoglycemia, fear of like carb overload. There's so many things that even then it leads to diabetes burnout, and it's such a positive feedback loop that is so frustrating. But just want to say the tenacity that everyone has here, I think, is incredible, and I think that's what really connects us as people living with diabetes, is the fact that you understand right away. You understand how struggling it is, how hard it is mentally, not only just physically. So thank you so much. As a reminder, you can find Julissa on social media platforms. You have a YouTube channel, a podcast, you have a blog, you have Instagram, you have Twitter. Yeah, you have it all. So thank you so much. We really appreciate it here at Connected Emotion, and thank you everyone for tuning in today.
Thank you everyone for being here, and thank you for sharing all of your experiences.
Yeah, great. I'm gonna end it. Bye guys.